The federal government has asked all the states administering the COVID-19 vaccine to stop the exercise the moment they use half of the doses allocated to them. Now, this means a state that was given 100,000 doses would have to halt the vaccine rollout once it administers doses. The administered doses hit 50,000. That's in order for those who have received their first jab to be able to complete the vaccination. Now, the move, it was learned, had become necessary due to a possible delay in the supply of the next batch of the AstraZeneca vaccines, which could affect the availability of the vaccine for a second jab for those who have taken the first. The shortage of the AstraZeneca vaccine in the international market is caused by a surge in the demand by the European Union and a new policy by India, which manufactures the vaccine. India had said last week that it would prioritize domestic vaccination for its over 1.2 billion citizens, thereby causing a shortage in developing nations like Nigeria. And joining me to discuss this is a public health physician, Dr. Ganiyu Jamiyu. Dr. Jamiyu, talk to us about the implication of having the first jab and not getting a second within the stipulated time.
Well, the implication is that it may affect the protective ability of the vaccine. It's not that the first jab will not convert some level of protection, but it will be in the range of 65 to like 75%. But having the complete dose will give closely to about 95 to 97%. That's what is the implication. And apart from that, something that they said for it to be to give a kind of maximum effectiveness, you need to get a second jab. So giving one, I don't think it will be in line with the guideline and why the vaccine is actually being made. So I think that's just a major. It will not confer the ideal immunity that is expected from such a vaccine.
So if you're supposed to get a second jab in 2 weeks, but you didn't get it in a month, will it still be as effective?
Well, like as the one we are currently being given, the AstraZeneca, it takes a minimum of 28 days to maximum of 3 months. So I think there is a sum of the period is a bit accommodating to be able to get a second jab. So I think with the current and based on what you just said, like in Lagos, we've not received that directive that they should stop giving people first jab. We are still giving people the first jab up to the next 5 days because we started with 10 days. We are now in the second 10 days. So today is the 15th day we've started, and we are currently still giving the first jab. So I don't think we are having such issue by now. Maybe it depends on the state, and as you said, the quantity that is being given to that state actually depends on whether they should stop it or not. Then Lagos it has not been stopped. And to continue to say more about what you just said now, there is ample of allowance, as I said, 28 days to 3 months. So we are hoping that before that time, maybe they will have getting more of that vaccine so that.
Dr. Jamiyu, did I hear you clearly? Are you saying that Lagos is yet to exhaust 50% of the doses that it has received?
I didn't say 50%. What I'm just saying that currently we are still giving first jab to eligible clients that come for the vaccine.
Well, that's the point the federal government is making, that there's possibility that they don't get the vaccines in time, and so the states should ensure they don't give more than 50% of what they have. I'm asking if that information is not coming too late.
The plan was that by now, by April, they should have been, federal government should have gotten more consignment. Maybe based on some logistic reasons, some delay, they decided to, take caution to ensure that people that have started are not denied of second jab. So I think that just being cautious and ensuring that those that have started are not left out at the end of the day, which I think it's reasonable enough.
All right, we'll keep our eye open and see how this vaccination drama evolves. Public health physician Dr. Ganiyu Jamiyu, thank you for talking to us.
Thank you very much.
Now let's turn to